Actually, healthcare supports economy wherever in UP or India or anywhere else in two fashions. One is the health industry itself in terms of the hospitals, employment of the nurses, doctors, diagnostic services, ambulances, and the entire paraphernalia and the economic outcome of that. But that is only one part. The major part is your output relationship to investment is based on your productivity of the society. And the productivity of the society is very much dependent on health and education. If you have a healthy society, it can be reasonably assumed that your productivity will be more. And therefore, with a comparatively less investment, your output will be more. So I think that is the area in which health contributes to the economy more than only the health industry part. So I would say that is the prime drive or the prime help or the prime move that the health does to economy of any country. A healthy country, a healthy state will have more productivity, human resource productivity, and therefore less investment will be required comparatively for the same amount of output. In some areas, for example, in significant areas of controlling certain diseases which are vector-borne diseases like Japanese encephalitis and AE, the state has made remarkable achievements in the last 4-5 years, and almost the mortality rate in these have gone down significantly. Also in terms of maternal and child health, in terms of the global indicators of maternal and child health like infant mortality rate and neonatal mortality rate and maternal mortality rate, the state has done well, and all these indicators show an improvement. India also shows an improvement. The state's improvement probably is at a faster pace than India's improvement because of a legacy lower base. But there has been a significant improvement in all these indicators, which will drive the country forward, drive the state forward. Having said that, we have to do a lot more, both in the public sector as well as in connecting with the private sector, both for profit and non-profit. I think one focus area is definitely to have is a human resource. We have to have in the government sector doctors in place, nurses in place, and that is why if you see we are going to distribute appointment letters to staff nurses 2 days from now. Around 1,300 nurses are being recruited. We are in the process of finalizing with the for next state of doctors. We for the first time recruited specialist doctors. So in the public sector, we have HR is a major issue, and we have to tackle that to keep a motivated, highly trained human resource who can handle today's technology, today's equipments. But also we have to connect to the private sector, give them, for the people who can pay at least, the ease of business. And at the same time, people who cannot pay, I think Pradhan Mantri Jan Arogya Yojana, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is in many ways a right step in which the government funds for the people who cannot pay, but the private sector provides. So in that scheme also, I think we have now generated from the demand side more than 2 crore Ayushman cards, and from the supply side we have 3,000 empaneled hospitals who are now significantly contributing. And in this year we have spent around 800 crore rupees already in this financial year reimbursing the bills of these Ayushman patients. Actually, the fact that which is such a huge pandemic, India is back on its feet is a exemplar, shows how resilient we as a system and society were. And it goes in both sides. You cannot tackle all this with only government support. So there's a huge public behavioral change that also took place during that time. And going forward, I think in many ways people have realized that they also have to take care of their own health. Health cannot be left only to providers and doctors. Like somebody says that the battles are too important to be left to generals. Similarly, I don't think health is too important to be left only to doctors. We have to take care of our own health, our lifestyle changes, our healthy food, diet, yoga, meditation. These are extremely important, and people have started realizing that, I think, that one has to give importance to these and especially the non-communicable disease part, that burden can be reduced by significant effect by this. For the communicable diseases, India is now moving a stage where these are being taken care of through immunization, vaccination, and slowly the NCDs will be more important. And here I think people have to take care of their own lifestyle to reduce this burden on themselves as well as to the society.